Hello, Dr. Ben Lynch here of Seeking Health Educational Institute. Today I want to talk with you about niacin, vitamin B3. It's an essential nutrient for you and your patients. Now, what I do want you to know about niacin is it's used in over 400 enzymatic reactions in the human body. That's very impressive. So, if you're supporting one pathway, say the methylation pathway, with a lot of methylfolate and a lot of methylcobalamin, then your patient's doing really well, and then they start to do poorly, and you've read recently, or have you heard recently, or you heard at my conferences, to give niacin to offset those side effects, and they work. You're thinking, well, why does that work? Well, because you're supporting one pathway really hard, and you're causing a deficiency in essential nutrients such as niacin. So methylation is doing over 200 enzymatic reactions, and if your patient is niacin deficient, then there's 400 enzymatic reactions that are being pushed but can't go anywhere. So what are the symptoms that your patient can have from a niacin deficiency? Well, we already know, possibly you don't, but that's why you're hearing this today. Irritability is one. So if you're pushing methylation pathway and your patient suddenly gets irritable, and I say suddenly, it can happen pretty quickly with these types of powerful nutrients. Niacin can offset irritability, can also offset headache and migraine. And I'm also wondering if it can help offset acne or skin problems in your patient. I'm not sure on that, but the other two I'm absolutely sure. I've seen it clinically and I've seen it in the research. Now, another key point that you should know about, when you're supporting methylation, you are also supporting cell reproduction, right? Cell replication, reproduction, cell growth. Your bone marrow produces a lot of cells, right? In the patient, the bone marrow is pumping out cell after cell after cell. Niacin is in very low amounts in the bone marrow. So if you're pushing methylation in your patient or offsetting a deficiency of red blood cells because they're anemic and they get side effects, they're possibly niacin deficient because of that low amount of niacin that's stored in the bone marrow. So give some niacin to your patient who have these symptoms, replenish the niacin in the bone marrow, and watch the side effects diminish, because it's really important. Low niacin in the bone marrow equals oxidative damage and DNA damage. Now, if you're supporting cholesterol in your patient, and you're reducing lipoprotein a and you're giving high dose niacin, you're using again a high amount of a single nutrient or specialty nutrient, and you're going to cause a deficiency in the methylation nutrients. So again, you have this balance. Every patient that walks in your door is different. They have a different name, different look to them, different clothes. Their biochemistry and physiology is also different. Keep that in mind. They might have high cholesterol. Maybe all your patients come in with high cholesterol. Doesn't matter. You still need to isolate and understand that their biochemistry and physiology and genetics are different. Whoa, wait. Sorry, I forgot about this. SHEI 2015, have you heard about it? You just enjoyed this video. I hope you're excited about it. This information is very clinically relevant to you and your patients. SHEI 2015 is an upcoming conference in October that you can't miss. There's 400 like-minded people like me, like yourself, that want to know more about how to optimize the health of your patients. You have 4 days of it. You have 400 doctors who are wanting to get more information on this and do what they need to do and transform medicine and transform the health of your patient and transform your practice. SHEI 2015, you can do it. Learn more at seekinghealth.org. Thank you.